This has been a really great discussion. We've received and discussed a lot of information on emerging approaches and recent advances in breast cancer, and I think that our panel has done a great job here. I think we've really given a very nice perspective. I'd like to get some final thoughts from each of the panelists, and I'll start with Kim.
Okay, well, first of all, I think you've done a great job leading us through a lot of data. One of the things that makes it so exciting to be a breast cancer doctor is we do have large trials, and we actually do have data and options for our patients that have very little toxicity and a lot of efficacy. So I think at this point, we really are trying to move forward with bridging the science to all these great drugs and really getting the right drug to the right patient. And that's really the joy and fun of taking care of breast cancer patients.
Joyce?
No, just echoing what everybody has said. I think the next big advances will come through the PI3 kinase pathway and the CDK4/6. I think that leaves us still struggling with the triple negative breast cancer patients. We're still in the hypothesis generating, understanding the biology of that. But hopefully at this meeting we'll hear some good information about homologous recombination deficiency type cancers and some perhaps some advances with adding carboplatin and veliparib onto helping a certain subset of the triple negatives.
Mark?
This is really an exciting time to be in breast cancer research. You know, I can remember earlier in our careers where there were only a couple of trials of trastuzumab, and it was pretty easy to remember the acronym names for the trials because there just weren't any more. But now, every meeting, every ASCO, every European meeting, every San Antonio, there are practice-changing data sets all the time, and it does become increasingly impossible for me to remember all the alphanumeric and named acronyms.
Well, first, thank you for leading our panel, and it's an honor to be with my colleagues on this panel. It's a great group. I think one of the things that we haven't talked about much is immune modulation, which is an exciting new approach. And I think I'm very interested to see what this will do in breast cancer. I think we've gotten to more of the nitty-gritty of trying to regulate immune response and understand tumor-infiltrating lymphocytes. We'll see some data at San Antonio on that as well from the JEPAR group. And there are many other publications, of course, and work going on, and new agents that are impacting the immune response of the cancer, both positively and negatively. So that's an exciting area to look to as well. There are vaccine studies that focus on HER2, that focus on polysaccharides that are very interesting, I think. And then, of course, you know, in the long term, I think that HER2 is going to become less of an area we study. I agree with George Sletch that it's going to become less of an area we study because the treatments that we're moving into the early stage setting are going to cure the majority rather than the minority. And maybe some of these treatments we're using for hormone receptor positive disease, the PI3 kinase inhibitors, the CDK inhibitors will be the ones we turn to for those small population of recurrent HER2 positive disease.
Denise?
Well, I think you've also done an excellent job, Adam. And, you know, I think to add on what all of the panelists have said, I think it's certainly an exciting time to be a breast medical oncologist and really see the development of the science followed hand in hand with the development of drugs that really utilize what our bench scientists have really found out to tell us about cancer. I think, you know, we've got all of our novel targeted agents. I think TDM1 has been great for the HER2 positive, but I think that whole antibody drug conjugate, we have LIV1 antigen for ER positives with Seattle Genetics, I think, has a drug for them and looking for ER positives using an antibody drug conjugate. Celldex is looking for glamatumomab and the triple negatives. And so I think, you know, the development of these targets and now novel ways to broach these aspects of the targeted tumors has made it really a great time to be a medical oncologist, but also for our patients. And I think more and more our patients are educated about the powerful role of clinical trials and participating in them and how their outcomes are continually improved.
Great. Well, I want to thank everybody here. I think this has been a great panel. Hopefully, on behalf of our panel, we thank you for joining us and hope you found this peer exchange informative. Again, thank you all very much, and thanks to our panel. Thank you.